This is 22 News in Focus.
Welcome to 22 News in Focus. I'm Rich Teddemer. Social service organizations across the country are seeing an increased demand for their products and services. In Western Massachusetts, the regional United Way offices have joined together to create the United Way COVID-19 Recovery Fund of Western Massachusetts to provide long-term recovery funding for our collective region. To discuss this new collaborative and other resources, I'm joined by Paul Mina, President and CEO of the United Way of the Pioneer Valley. Paul, thanks for being on the program today.
Thanks for having me, Rich.
Nice to have you here. First, talk about the United Way of the Pioneer Valley and what it does.
Well, the United Way of Pioneer Valley is one of 1,350 United Ways across the country that are independently operated by a local board of directors who live and work in the community. They decide how the money is raised and spent, and it's all local. We do 25 communities in Pioneer Valley. It's our area of concentration for the United Way of Pioneer Valley. So we've got a pretty big area and a very loyal and also a very needy constituency. We've got a lot of work that we do every day, and during this COVID-19 pandemic, it's been a little additionally crazy. So
I'm sure for all of us, no doubt about that. So you cover a big area. How many organizations fall under your umbrella?
We fund 26 agencies, and they do tons of good things. They provide food for the hungry, basic human needs, food, clothing, shelter. We also are the largest funder of after-school programs for children in the entire region. Daycare, after-school care. We also fund the United Way's Mass 211 hotline, the Call to Talk mental health and suicide prevention line, and our Thrive program, which is an economic empowerment program that we own and operate, are all things that are a service delivery that it's the product of the contributions that people give us when they support the United Way of Pioneer Valley. So it's those community investments all stay local, Rich.
During this health crisis, are you seeing an increase in requests for help?
Yeah, an awful lot. The agencies are telling us that, some of them need additional volunteers, some need additional funding, some of them are trying to, they need some help in determining a different service model. Some of the food programs, for example, have had to migrate to a curbside pickup situation instead of having folks come into the building and eat a meal. You can't congregate, of course. So it's been a big transition for them, both the food pantries and the cafes where people get hot meals. So it's all been made very portable, and of course, social distancing is the watchword of the day.
What is the 211 hotline?
Well, Mass 211 is United Way's statewide information and referral hotline. It annually takes about 150,000 calls. It's free. 24 hours a day, 7 days a week. We answer the phone in 140 different languages. The 201 hotline has been an integral part of Governor Baker's response for the COVID-19 pandemic. We're under contract with the Commonwealth of Massachusetts through our relationship with MEMA, the Massachusetts Emergency Management Agency, to be the consumer hotline during times of emergency and crisis. So the governor has been telling people to call 211 for official information. We've taken 64,000 calls to date just for the COVID-19 skill set, which is a tremendous amount of calls in a very short period of time. And our mental health suicide prevention line, Rich, it's called Call to Talk. That line has taken over 16,000 calls in the same period. So the phone literally has been ringing off the hook. It's record breaking, and people are very much anxiety filled. They're very stressed right now because, you know, they're out of work, a lot of them. They're worried about paying their bills, daycare, going back to school, going back to work. What are they going to do with their kids in the summer? Lots of very important questions that are yet to be answered.
Yeah, a lot of those questions we're all asking, as a matter of fact, right now. You mentioned
Yep.
Call to Talk, the emotional support line there, and suicide prevention. What actually will someone get when they call that number?
They get to talk to a person who is trained to deal with individuals who are experiencing stressful emotional times. They're also trained to determine whether or not a person appears to present as being harmful to themselves or to others. And in cases like that, we have a protocol in place where we work with the authorities to keep the person on the line, to talk to them. At the same time, we work with the authorities to pinpoint their location and hopefully prevent them from doing something that they and their families may regret. It can oftentimes be a final decision, and it's never the right decision.
Yeah, you mentioned over 64,000 calls. How is the United Way handling that huge influx?
We're handling it, but the impact on our budget is enormous. We have a tremendous amount of overtime. We're running 25 to 30 call takers a shift on the 211 hotline. So it's over the last week, the numbers have gone down a little bit. We're very grateful for that. Things have slowed down a little bit, but we're ready for another surge if that were to happen. It's one of those kinds of things, Rich, where you have to be prepared for all these things in advance. So we're trying to make sure that we always are.
All right, Paul Mina from the United Way. We'll continue our conversation as the United Way has a new collaboration to address COVID-19 needs. We'll learn more right after the break. You're watching 22 News in Focus. Back to 22 News in Focus. Today we're talking about services and programs from the United Way for people impacted by COVID-19 with Paul Mina. He's the president and CEO of the United Way of the Pioneer Valley. Paul, once again, thanks for joining us.
Thanks for having me, Rich.
What is the United Way COVID-19 Recovery Fund of Western Massachusetts? We talked about that earlier. What is that, though?
It's a fund that is a collaboration among the United Way of Pioneer Valley, the United Way of Hampshire County, and the United Way of Franklin County to allow the donors in the Pioneer Valley area and Western Mass in general to be able to give to a relief fund, a recovery fund that will cover the entire region. And it's different than other funds in that it's for recovery, not relief. We know that historically, when these kinds of things happen in the past, they have always been front-end loaded with donations, but not very much there afterwards for the long-term recovery. And that's where the lion's share of the need is in long-term recovery. So the three United Ways in this region got together, create a single giving platform. You can reach it by going to www.uwpv.org, and you can make your contribution if you want to give to the funds that are directly going to help the communities covered by those three United Ways. You can select which of the United Way territories you want your money to go to, so we can really pinpoint where you want the need to be addressed. We're going to be dealing with funding things that a lot of these other funds, which are all very important, but they're different, as I said, are focusing on basic human needs, food, clothing, shelter. Those are things that are going to be, unfortunately, after when the epidemic, the pandemic slows down, the need is going to continue to be there, but people are going to be moving on to going back to work. They're going to be hopefully, back to some sense of normalcy. And charitable giving is not going to be top of mind awareness, Rich. So this fund is to be able to sustain the life-saving programs that are related to food, clothing, and shelter in the communities that we're dealing with. So Um, it's a very important thing that we have resources to continue the response to this terrible disease.
Terrible and scary at the same time, and everyone wonders what we're going to lose when we go through this and get out the other side. And you mentioned recovery, not relief. That is really a good mantra to have.
Yeah, an example of that. We have a program called Thrive. It's really a financial coaching program where, for no money, it's free of charge to anybody that calls. They can call our 800 number. It's 833-308-4748. They can talk to a trained counselor who will help them with accessing COVID-19 resources, unemployment, stimulus checks, student loans, all kinds of things that people have questions about now. And they can help them build a budget, help them improve their credit. These are all very important things because a lot of the folks right now are worried about going back to work. They've been laid off, they've been furloughed, they're not sure that they're going to be hired again. Their unemployment benefits will run out. Most of these very generous benefits that are out there right now are going to end in 8 weeks. So it's a very important thing that people have somewhere to turn to get real information that's accurate, and we can help people to move beyond the crisis. So those are the kinds of things that we're trying to make sure are in place so that people get the sustained recovery help that they need.
On your website, you have a new volunteer portal. What is this and who's that for?
Well, it's called the Golden Volunteer Platform, Rich. It's a new platform that we've purchased that allows us to, in a very, I would say, modern way. Of course, that's coming from somebody who's my age. Modern is relative. But it's a very good platform for people to go on to be able to match the ability to help with the need for help in the community. So if somebody wants to volunteer, this is a very slick Amazon-like platform, very, very easy to use, easy to navigate, and companies and organizations and individuals who are willing to help in the community, have the resources to help, we can connect them to the organizations that need the help and make sure that everything goes correctly, that we connect them one to another so the experience is good, and that we get a lot of good stuff done to help people in need. It's a really good platform. United Way really is synonymous with volunteerism. When I was trained in the United Way system 31 years ago, I had to go to they had the training that you received was the National Academy of Volunteerism. So United Way and volunteerism are synonymous, and this is a natural progression for our United Way in Springfield to be able to have this wonderful new platform that will help make it so much easier for folks to be able to volunteer.
Paul, I like how you said the modern way. I think back of 1989 or 1990, just a couple years ago, but we all know better now, right?
I think it is a couple years ago, but not really.
All right, we'll continue our conversation after a short break. You're watching 22 News in Focus. You're watching 22 News in Focus, and today we're talking about COVID-19 resources and programs offered through the United Way of Pioneer Valley with Paul Mina, the president and CEO of the United Way of Pioneer Valley. Paul, once again, thanks for joining us.
Thanks for having me.
The United Way supports many organizations year-round that provide thousands of programs in the region. How are you and your staff working these days from home or via teleconference or internet conference?
Well, because we're considered non-essential emergency services in Springfield, we are working from home. Most of the team is. Some of us are working in the office, but most of the team is working from home. We have staff meetings every day online, and we're really doing everything we normally do. We're raising money, we're distributing it. We've had some great programs that we've been able to do in the last 6-7 weeks. 6 weeks ago, we were able to donate 5,000 hot meals to the greater Western Mass Food Bank. We were able to give the food bank the 5,000 frozen meals. They're hot meal entrees that were frozen. They were able to distribute those throughout the region here in Western Mass. So Andrew and his team at the food bank do a wonderful job. About 3 weeks ago, we began a partnership with the Boys and Girls Clubs of Springfield. We were honoring the first responders in our region who are so selflessly putting themselves in harm's way by providing them with a free breakfast every day. It was a drive-through breakfast. They would drive through the parking lot at the Boys and Girls Club in Springfield, and volunteers from the United Way and the Boys and Girls Club would bag and prepare and distribute those to the first responders. And we also delivered a number of those meals, those breakfasts, as a thank you to the first responders at some of the hospitals and ambulance barns and fire stations and police stations. We did that with our great partners at the Boys and Girls Club of Springfield. So, and then a wonderful thing that we're doing this week, yesterday we received a shipment of 6 pallets of brand new toys from our partnership with Goods 360, which is a national clearinghouse for products and product philanthropy. And those toys are going to be distributed tomorrow to a number of agencies that are going to distribute them to needy families that they service. And we're doing this so that we have a happy diversion for kids that are, cooped up in their house. A lot of kids live in apartments. There's not a lot of yard space for some of these kids. They're bored. A lot of them are bored and, can use a happy diversion. So we have a bunch of age-appropriate, beautiful new toys, including Legos and balls and trucks and stuffed animals and all kinds of stuff that we're going to be distributing to the agencies tomorrow and next week. And hopefully it'll bring some joy and a little happy diversion into the lives of these kids that are also dealing in their own way with COVID-19.
Wow. You started that whole answer by saying the United Way was designated as a non-essential entity. It's very essential. It sounds like the work that you're doing and everything that you've done so far is incredible, and it hasn't slowed you down one bit.
I would agree with you, but I understand the designations. There are organizations that are, right on the front line, and we're probably considered the next tier down, so that's okay. But we're working every day to do our job like we always do. The work doesn't stop because of a pandemic, so.
No, it certainly hasn't stopped for you. Last Tuesday was Giving Tuesday. That's a day to promote charitable giving. Did you get a lot of monetary donations? Did you hit your target?
Unfortunately not. We got money, and we did have some donations, and they're very generous, but we really did not get what we had hoped to get. It's one of those things, the Giving Tuesday situation is very good sometimes, and other times it can be overwhelming for the donor. The fund has been doing okay. We're getting, daily contributions, slow and steady. We did get an influx of donations that day, but we certainly didn't break any records. But, if anybody wants to help, Rich, and that's, always needed, they can just log on to the website at www.uwpv.org and hit the Donate Now button, and you'll see COVID-19 Relief Fund. And you can make a donation. You can donate your time or your treasure. We're grateful for both. And I just want to thank the community in Pioneer Valley. The loyalty and the support that we get is just incredible. And all of us at United Way are representing our board of directors, our professional staff team. We want to thank the community for their long-standing support.
In that theme, are you and your partners concerned that if this crisis extends into next year, that your resources could be depleted?
Very concerned. Very, very concerned. We get most of our money, Rich, from payroll deduction donations that employees give through their workplace campaigns. If they're not working and they're not collecting a paycheck, there's no payroll deduction. If people aren't working, they're not going to be predisposed to giving when they have to take care of their family first. So we're very concerned about that. And that's why we're trying our best to find alternate methods of fundraising that are not just workplace related to be able to help us fill the gap. There's no way to predict what the percentage would be or what the actual losses would be. But there's no question the environment, the climate will change and it will be different. And it will take some time for us to be able to get back to a place of normalcy, if that even exists anymore. You know, one of the things that we get all the time on the 211 hotline, the anxiety people feel is really because of the uncertainty. It's not so much when they get the facts that they can't deal with them. It's just they don't know what the facts are. And our leaders try very hard to be clear about it, but this is a situation that is pretty much free-flowing, and it's always changing. So we're just going to have to learn to be patient and to deal with it as it comes.
All right, Paul, we appreciate United Way doing a great job. We'll have the last word after the break. You're watching 22 News in Focus. You've been watching 22 News in Focus, and today we've been talking about services and programs from the United Way for people impacted by COVID-19. Thanks to Paul Mina, the President and CEO of the United Way of the Pioneer Valley, for being on our program today. And that is our program. Thanks to you watching at home. If you missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, have a great day. See ya.